Hyoid suspension with airlift is a procedure for people who cannot tolerate CPAP and have collapse of the airway in the lower part of the throat. If you've been diagnosed with obstructive sleep apnea and have found that CPAP or other therapies aren't working for you, you may be exploring alternative treatments. I'm Dr. Jordan Weiner, an ear, nose, and throat doctor in Scottsdale, Arizona, specializing in the management of obstructive sleep apnea. The hyoid bone is a small floating bone in the central part of the upper neck. Many muscles of the tongue, voice box, and throat attach to it. Hyoid suspension procedures reposition the hyoid bone to increase the amount of space in the lower throat behind the tongue. Since about 50% of patients with sleep apnea collapse in this area, hyoid suspension can be effective for them. Hyoid suspension has been performed since the 1980s with many changes in the procedure since then. In 2011, Siesta Medical got FDA approval for AIRLIFT. Hyoid suspension with airlift pulls the hyoid bone up and forward by anchoring it to the lower jaw. Moving the hyoid bone up and forward pulls the tongue forward and puts tension on the side walls of the throat. This helps keep the airway open for people with obstructive sleep apnea who have collapse of the airway at the base of the tongue, epiglottis, and of the side walls of the lower throat. Studies of patients who have had hyoid suspension show that this procedure by itself can reduce the apnea-hypopnea index by about 40%. About half of patients were considered adequately treated, meaning their AHI went down by 50% and was less than 20. The severity of sleep apnea improved for most patients, putting them at lower risk of other health problems. It's possible that these studies underestimate the improvement with airlift, since older studies used a variety of techniques, some of which are rarely performed today. For people who also have collapse at the level of the palate, this procedure can be performed with palate surgery, such as uvulopalatopharyngoplasty or UP3. When airlift is combined with UP3, studies show that AHI decreases by about 70%, and about 3/4 of patients are considered adequately treated. These success rates are comparable to Inspire and Genio. Airlift is helpful in patients with collapse of the airway in the lower half of the throat. After a detailed examination of the throat in the office, a drug-induced sleep endoscopy is performed to determine if there is collapse in this area. All patients with obstructive sleep apnea and lower airway collapse are potential candidates regardless of the severity of their sleep apnea. Patients at any BMI can have reductions in their AHI with this procedure, especially if combined with palate surgery. However, the patients who get the most reduction in AHI are those with a BMI under 30. The surgery is performed through 2 small incisions under the chin. First, an inch-long incision is made under the chin and 2 small holes are drilled into the mandible. Anchors are inserted into the holes. A second small incision is made in the upper neck over the hyoid bone. 2 specialized sutures are secured to the hyoid bone. The ends of these sutures are attached to the anchors in the mandible, and tension is applied, pulling the hyoid bone up and forward before they are tightened and locked in place. Infection and bleeding are risks with any surgery. Fluid collection can occur under the incisions and could require drainage. These complications are uncommon. Following surgery, most patients have mild swelling and discomfort for a couple of weeks. Strenuous activity or heavy lifting should be avoided for 2 weeks. Hyoid suspension with airlift can be an effective treatment alone or with other throat surgery for people with collapse in the lower airway who are not candidates for Inspire or Genio, or who are looking for a permanent solution that doesn't require implanted devices or batteries. For more information about airlift, as well as my practice, please go to weinersleepsurgery.com. Don't forget to like and subscribe to Unmasked Beyond CPAP.